Yes, thanks, Stephen. All right. Hi, everyone, and thanks for joining us today. Welcome to our first seminar of 2025. For those of you who don't know me, my name is Hank Sherwood, and I'm a postdoc at UT Austin, working with Dr. Stephen Russell. And I'm also a member of the team that helps organize these seminars. We're excited to offer these throughout the semester and over the course of the year, and just to share some of the exciting work being done on the topic of SGM health. Today, we're going to hear from Dr. Asa Burson. After the presentation, we'll have some time for questions for the presenter, and then we'll open the floor to give everyone a space to discuss some of the current state of our field. But first, a little bit about today's presenter. So Dr. Asa Burson is an assistant professor of psychology at Smith College and an applied psychologist who uses qualitative and quantitative methods to explore themes of critical consciousness and intersectionality. Their research explores how adolescents with marginalized racial, ethnic, sexual, and gender identities form attitudes about social, political, and economic inequality, and how these attitudes impact well-being and intergroup relations. They use theories from developmental, social, and community psychology to frame their questions. Today, Dr. Burson will present recent work on applying the concept of critical consciousness, which is a developmental competency that empowers low-income, racial, and ethnic minority youth to confront oppression. So they'll be applying that to SGM youth. In their paper, Queering Critical Consciousness, they use an intersectional perspective to validate current critical consciousness measures among sexual and gender minority populations and examine the relationship between critical consciousness and SGM youth well-being. Dr. Burson will also discuss the implications of this work for future research on SGM youth thriving. If you have any questions during the presentation, feel free to type them into the chat box, and we'll try to get to them after the presentation. Now, without further ado, Dr. Burson.
Great. Thank you so much for that introduction, Hank. And thank you to Hank and Kyle for bringing me here today. I'm just going to get my screen share up and running. So as Hank mentioned, I am primarily trained as an applied developmental psychologist, and have done also some work on SGM youth health with Ryan Watson and his team, which is kind of how I got in to this field. And this paper I'm going to share today is looking at kind of the bulk of what I study, critical consciousness, which is a developmental concept, looking at that among queer youth. So this is kind of bridging my two interests. So I'm going to dive right in. Figure out how to make it work. There we go. So what do I study and why? Well, I think everyone in this room is pretty aware that inequality is persistent and extreme in the US, especially right now. Despite being a wealthy, highly developed nation, we have kind of dramatic asymmetries in access to resources and opportunities, usually along the basis of demographic characteristics such as race, socioeconomic status, gender, sexual orientation, just to name a few. I'm not even kind of getting into the domain of overt discrimination or prejudice, although those are definitely kind of important to critical consciousness as well, and are extremely real and harmful. But for now, I'm focusing kind of more abstractly on access to resources such as pay, education, political power, and healthcare being limited for members of particular demographic groups. And in addition to kind of this inequality being severe, you can see that it's become increasingly salient in the US. These are Google Ngram views of how often terms like inequality, racial inequality, gender inequality have showed up in published books from 1900 to 2022. Unfortunately, we don't have data after 2022, so I don't know about any recent spikes. But we're seeing kind of in the national discourse, there's a lot more conversation about inequality. People are kind of aware of diverse types of inequality increasingly. And this increased awareness and discourse begs the question of how the social groups at the receiving end of this disparity in resources, this inequality, make sense of and react to these persistent inequalities. And that's where we kind of look to the developmental psychology theory of critical consciousness, which itself we have taken from the radical pedagogy of Brazilian social reformer Paulo Freire. And this idea of critical consciousness tries to explain marginalized young people's reactions to unjust social realities. So in particular, there's this idea that kind of education about political, historic, social, and economic forces that shape current discrepancies and inequality will empower youth to act to change these oppressive systems. And we term this whole process critical consciousness. Um, Developmental psychologists break down this construct into three interlinked components of reflection on inequality, efficacy and motivation to change inequality, and action to fight it. And within developmental psychology, some researchers have even gone as far as calling critical consciousness, like these three linked competencies, an antidote to oppression for its potential to empower marginalized youth to fight against unfair and inequitable systems and dismantle oppressive realities. And there's kind of been a flourishing of research in this domain from kind of the past 25 years, in which we've seen critical consciousness linked to a range of positive outcomes for youth from marginalized racial, ethnic, and socioeconomic status backgrounds. So critical consciousness has been linked to increased political and community participation, as might be expected, but also to a range of positive individual, academic, and occupational outcomes. So increased ambitions, increased success and achievement in those domains. There's also some evidence that critical consciousness may predict better well-being and thriving for marginalized youth, although the findings on mental health are kind of disputed and somewhat inconclusive. We can talk more about that later. Just to recap, these are kind of the main subcomponents of critical consciousness, and it's kind of a messy construct because critical consciousness involves these three dimensions of reflection, efficacy, and action all working together, even though we do have research that there are kind of different latent profiles of these components within an individual, but we're, for now, thinking of them all kind of operating together. So critical consciousness overall is thought to apply to really any group, social group that faces marginalization. But the current scope of this research is somewhat narrow because the bulk of empirical research in developmental psychology has focused exclusively on low socioeconomic status, Black and Brown youth. And this research usually conflates race and class, and often kind of lumps different racial ethnic minority groups in together, and doesn't distinguish potential different patterns. And this conflation limits our understanding of critical consciousness, and we kind of have this lack of generalizability of key processes to other groups, which limits our ability to design interventions or to just understand in general how critical consciousness works for diverse groups. Theoretically, there are reasons to believe critical consciousness could be particularly relevant to sexual gender minority youth. We know that SGM youth face persistent and systemic marginalization, both at the structural and interpersonal levels. So we've got disparities in access to healthcare and education. We've got disparate mental health outcomes. A lot of this is due to kind of structural stigma stopping these youth from getting the access they need. We also know that sexual gender minority youth are at increased risk for negative mental health and academic functioning, which are both processes that empirically have been linked to, critical consciousness has been shown to foster positive outcomes in these domains, so could be helpful for queer youth in that way. Also, there is kind of a community tradition of activism and kind of being in consciousness raising spaces among queer youth, which might promote critical consciousness development. So this might be a demographic that's already very high in critical consciousness. So it would be important to know what critical consciousness is kind of doing for outcomes in this group. But to date, we have very little existing research on critical consciousness in sexual gender minority youth or sexual gender minority populations at all. So this kind of led to the questions of, is critical consciousness even relevant for sexual gender minority youth? What do I mean by that? Well, are the measures that were designed and validated with samples of heterosexual racial ethnic minority youth going to be valid for sexual gender minority youth of different racial ethnic backgrounds? Um, are we going to see that critical consciousness relates to positive outcomes for sexual gender minority youth? And how are these processes different for sexual gender minority youth with different racial ethnic backgrounds? So the current paper asks these questions. These data came from a group called the GSA Research Consortium. So that's Paul Petit at Boston College, Hiro Yoshikawa at NYU, and Gerald Calzo at San Diego State University, um, who are just fabulous people and very generous with their data. I can't say enough good things about them. So the data for this project came from a survey of about 4,000 middle and high school students in 38 schools across Massachusetts. Two waves of data collected in fall and spring semesters in 2016, 2017. So this is first Trump term to kind of situate the moment politically. And youth were completing surveys on academic outcomes, mental health, risky behavior, and critical consciousness. We had some items in there. For the analytic study for this sample, we kind of talked a lot about how best to employ an intersectional lens here that would acknowledge that youth with different kind of combinations of traditionally marginalized identities would likely have qualitatively different experiences. And we wanted to avoid collapsing those nuances as much as possible. So we wanted to kind of tap into specific experiences for each group. But kind of due to limited sample sizes and doing research in the real world, we weren't able to look at diversity within the SGM community. We kind of could look only at, do you identify as sexual gender minority or not? And due to kind of limited sample sizes and lack of racial diversity in Massachusetts, our sample sizes were small enough that we did have to combine Black and Latinx youth into one group. There is theoretical justification for this choice because most past critical consciousness research focuses on these two demographics and often uses mixed groups of Black and Latinx youth, suggests similar processes for both these groups. So our group of Black and Latinx or Latina, I think we use the terminology Latinx in the paper because we wrote it a while ago. Now we say Latina as that's kind of typically preferred. So we kind of have this comparison group of non-sexual gender minority, Black and Latina youth who represent the groups typically studied in critical consciousness research. We are comparing critical consciousness in that group to critical consciousness among Black and Latina youth who do identify as sexual gender minority, and then comparing this to white youth who identify as sexual gender minority to try to get at these dimensions of both race, ethnicity, and sexual gender minority status. Just a note, we did exclude other racial ethnic minority groups from these analyses because sample sizes were too small, and past critical consciousness research suggests that critical consciousness actually looks quite different in other ethnic racial minority groups to the extent that we know about it. So those were our groups of comparison. We are in terms of kind of that, those were the groups of comparison for our measurement models and for the multi-group analysis in our structural models that we'll talk about in a minute. In terms of what variables we measured, we did measure critical consciousness. So we measured these three dimensions of critical reflection, of political efficacy. We captured with a social justice efficacy scale. Critical action, we had, unfortunately, only a categorical variable measuring membership in social justice related clubs. So spoilers, is a huge limitation of the paper that we have only this categorical variable for action. And then for outcomes, we measured depression and grades. And we were adjusting for covariates, so socioeconomic status, GSA membership, and sex, for which we were just comparing cis male to all others as our reference group. So our analytic plan here was first do this confirmatory factor analysis of the factor structure of critical consciousness in the full sample, then measurement and variance of this factor model of critical consciousness across these groups to see if it is indeed the same. And finally, looking at a multi-group structural model to predict outcomes of grades and depression from critical consciousness. And we had the outcomes at time 2 and the critical consciousness at time 1. So we did establish a well-fitting 2-factor model of critical consciousness across the full sample with the factors we would expect of critical reflection and political efficacy. Unfortunately, couldn't include action. Fit statistics were good. We're kind of following Klein's guidelines, CFI above 0.95, SRMR below 0.08. The REMC was like kind of high, but we're following the guidelines that if it's below 0.1 and other indicators are good, then it's fine. Okay, we've got our similar factor structure. We're good to at least try measurement invariance. Testing measurement invariance across groups to just see if this measure works the same for different groups. We established configural invariance and partial metric invariance across groups. You see that the model fit is, again, pretty good. In order to get metric invariance, we had to release one item in one group to be constraints invariance. We were unable to demonstrate scalar or residual. Well, we couldn't demonstrate scalar, so we didn't go on to test residual invariance. But having the partial metric invariance enables comparison of correlations across groups. So that's what we did next. We explored structural models, a multi-group analysis predicting time 2 depression and grades from time 1 critical consciousness, adjusting for demographic covariates. I've got the full results here. I'll talk through them on the next slide. Again, the fit for this model is pretty good, not excellent. So the results are a little confusing because we tested 3 components of critical consciousness, predicting 2 different outcomes across 3 groups. But I'll talk us through the main findings here. First, worth noting that critical reflection was significant only for the white sexual gender minority youth, for whom reflection was predicting higher grades. Second, we saw that political efficacy was good for all 3 of these groups, but in different ways. So this political efficacy predicted higher grades for each group, and lower depression for non-SGM Black and Latina youth and for white sexual gender minority youth. Finally, critical action was predicting higher grades for both sexual gender minority and non-sexual gender minority Black and Latina youth. So I'll get into that more in a minute. So kind of to go back to our main questions of, are these measures working for this population, and how does critical consciousness predict outcomes? Well, to our first question, are these measures valid for SGM youth? Yes, with caveats. So the CFA results and the configural invariance results suggest that the measures we tested show the same factor structure in each of these groups. So there's like the same basic idea of what critical consciousness is for these groups who are facing marginalization along different dimensions. The partial metric invariance suggests factor loadings are basically comparable across groups, except for the one item that we unconstrained, which was an item about it was a critical reflection item about certain racial ethnic groups having fewer chances to get good jobs, which we had to unconstrain for white youth, suggesting that, okay, yeah, white youth maybe were like less aware of this. This item was less central to their critical reflection. Worth noting, the lack of scalar invariance does suggest that item intercepts vary across groups for the white sexual gender minority youth, Black and Latina sexual gender minority youth, and Black and Latina non-sexual gender minority youth. So we really can't compare factor means across these groups. And we might see that kind of different underlying levels of critical consciousness are required to drive endorsement of these items for the different groups. So that's big caveat. Kind of overall takeaway, these measures are appropriate for use with sexual and gender minority samples. Like, yeah, they work, but they might not be optimal because they don't assess sexual gender minority specific issues. These were all measures kind of designed to assess awareness of racial discrimination and class discrimination. And so these measures might fail to capture important aspects of sexual gender minority youth's critical consciousness. in terms of this question of does critical consciousness relate to positive outcomes and how are these relation links different across groups? Um, okay, we found critical reflection was significant only for white sexual gender minority youth for whom it predicts higher grades. Um, we again found political efficacy seems to be really important here, predicting higher grades for each group. It didn't predict lower depression for the sexual gender minority, Black and Latina youth, but I think this was an issue of power. This was the smallest group. I think we just couldn't pick up any potential effects. So I'm not going to make anything of that null result. May or may not be a true null. And then we found critical action was significant really only for the non-white youth in the sample, for both sexual gender minority and non-sexual gender minority, Black and Latina youth. Um, and it's worth noting that while all components of critical consciousness were linked to better grades for one or more groups, it was really only political efficacy or this kind of internal sense of motivation and empowerment to make change that was linked to better mental health, to lower depression. So what happens next? Um, as I was saying, these measures weren't designed for sexual gender minority youth. So I'm happy that we have now showed that critical consciousness, like, we have an argument that it's okay to study it in sexual gender minority populations, but moving forward, I would like to compare functioning with measures that were typically designed for use with this population, or at least to assess critical consciousness of heterosexism, cissexism. Some of those measures do exist. Um, I'd also like to look at, these associations between critical consciousness and mental health in different political contexts. This sample was Massachusetts. It was all schools with GSAs. So that's a very particular context of liberal state that already have some school supports in place. So I'd like to be able to look at it elsewhere. Um, Also, it would be helpful to do some qualitative work to better understand if critical consciousness is kind of a qualitatively different process among these groups. That's something that, the measurement work told us that, yeah, these measures are similar among these groups, but, we might be missing things that qualitative work could uncover about potential, like, fully different approaches to what it means to think about inequality for youth who are marginalized, maybe along only one main salient dimension of identity versus youth who face kind of multiple forms of marginalization. Finally, I've just started some kind of experimental work to see if we can increase political efficacy experimentally. I think this is really important for interventions because it is looking like political efficacy is the key factor for mental health. I love this cartoon. This is how I think of critical consciousness and mental health. Like this reflection, this action are so important, but they can be really hard on you. And it seems like efficacy is kind of the piece that keeps you from feeling like a beat up frog. So how do we improve that in the future? So I'll stop there. I again want to thank my co-authors, just wonderful people to work with, and I can't endorse them enough. Also, I want to thank this article was for a special issue of Research and Human Development, and the editors were so supportive of me having a weird timeline to do this article while I was teaching new preps as my first year as a faculty member last year. So huge thank you to them for making it a good process. And also, thank you to the federal funding we had at that time, and to institutional support during grad school that supported this work. And thank you all for having me, and I will stop there.